Living Well, brought to you by CHRISTUS Cabrini Hospital.
Dr. Marjorie Broussard joins us. She is with CHRISTUS Cabrini Family Medicine Center. We want to talk about women and heart health. Of course, we take care of our families, we take care of our husbands, we take care of our houses, we're cooking, we're running around. We kind of overlook ourselves sometimes, don't we?
Yes, we do. And cardiovascular disease is the first cause of death among women in America. And I think there are several factors. We're the caretakers. We normally put ourselves last. Everybody else comes first when time to go check cups with the doctor. And also, it's misinformation. I think there's still a misconception that cardiovascular disease is a male problem. And it is not true, especially in women after menopause, the risk is really high. And a big factor there too is the fact that most women will have just symptoms that are not as severe and as typical, especially in with regards to heart attacks, as men do.
Like what?
Like instead of that chest pain in the middle of the chest that is very severe, like an elephant sitting on top of you, most women will present with belly pain or just fatigue or feeling short of breath or just feeling like they're going to pass out and just tired and depressed.
But then the big mistake that they often make is not getting to their doctor, not getting to the emergency room.
It is true. Most women that have a heart attack, they are actually surprised when they're told, oh, you had a heart attack. And also, you know, if you ask women, they will tell you, well, if I'm having a little chest pain, I'll take a little aspirin. But nobody thinks about calling 911, getting to the emergency room, and get checked right away.
But heart attacks kill.
Heart attacks do kill. And you know, the worst part of it is most of them are preventable. And I think that is important, and I think that should be our role, is to talk to those women and say, okay, yes, cardiovascular disease is most common in men, but we are at a high risk after menopause, and we should check and make sure that we know our risk factors and we work on those, like your blood pressure and cholesterol. If you have diabetes, make sure that that's controlled. Tobacco cessation is very important. Physical activity as well.
Okay, so that is very important to have a relationship with a physician, but then also, when do you need to know to go to the ER or to call 911?
Okay, so if you're experiencing, of course, chest pain, that's the most common presentation for a heart attack. Pain in the middle of the chest, it may be radiated to your arm. Pain in the top of your stomach or in the back or in the jaw. If you're having that with a little bit of nausea or sweating, if you feel short of breath, lightheaded, I think you should go ahead and call 911 and get to the nearest emergency room, because time is very valuable. We want to get there in the first hours of the episode.
And I guess the final statement today is women need to give themselves permission to not hold everything up.
Yes, ma'am. I think that that's a very important message there. We should, as caretakers, we should do as much as we can to be in our best health so we can take care of our families.
For more information, call 866-581-3627.